Hi, and welcome to this episode of The Waiting Room. We're speaking with Maureen McLeod-Fraser again, who is the manager of the emergency department, but she's also the manager of our operating rooms. Maureen, we just received these new Omni hysteroscopes. What is an Omni hysteroscope?
So a hysteroscope itself is a device that goes into the uterus through the cervix to visualize, to look at the inside of the uterus, but you also can see there's fluid that runs through it to clear the way. But the reason that we bought this was that it can do both things, where it goes in, you can visualize, but then if you see something, you can actually go in and take that out. So things like a polyp, if there's an irregularity in the uterus, you can actually see it, and then you don't have to come out, do something else to take that polyp out. You actually, right from this point, you can attach the other part, take the polyp out. The other added benefit of this is that it's very small, so you can see that it's the size of it, so it can go into the cervix. It's a smaller diameter, so it decreases the risk of perforating. And women who are postmenopausal, the lining can be really sensitive, and so there's more risk. So this decreases the risk of that and increases patient safety.
So Maureen, the Mississippi Mills River Run and Walk is coming up, which is our big fundraiser for women's health and the obstetrics unit. This was purchased with funds that we've raised in past years. About how many women would benefit from this?
So it's hard to estimate that totally, because the benefit of this is that you can go in and look. So you would use it on more women. I'd say, maybe 10 a month, but you may not use it to get a polyp, but you can still use it to do that. And then if you do need a polyp, then you can attach the other part to take the polyp off.
Okay.
So yeah, I'd say, 8 to 10 a month, and it just depends.
Yeah. And why are polyps, in terms of women's health, not good? We want to get rid of polyps because...
So polyps are usually just an overgrowth of tissue, but they are the precursor, or can be a precursor to cancer. So that's why it's important to identify them early, as well as remove them so that it doesn't go on to those stages.
And what was our team doing before we had this?
So before we had this one, there was a separate hysteroscope, so you would go in with that. And the quality of the camera wasn't as good. This is like you're taking a picture yourself. It's beautiful. But we would go in and look. Quality isn't as good. And then if you saw a polyp, you'd have to take the whole thing out. You'd have to get a new piece of equipment, put that in again, take the polyp out, which would take about 20 minutes to actually do that polyp with that equipment. This equipment, it takes, the one I watched today was about 7 to 10 seconds getting that polyp out.
So really a good use of donor dollars.
Absolutely.
Thank you very much, Maureen.
You're welcome.